Okay, fantastic. Thank you so much, everybody. We really are excited to be here with you today. A couple of visitors from East Carolina, I see, and Apopka and Okaloosa counties. So great to see you all, and we look forward to some questions later on. The study title that we are working on is Effectiveness and Implementation of Self-Management Strategies for Low Back Pain, and particularly for horticulture workers. The research team that we're working with is on the first slide, and Dr. Blythe, who's the research coordinator, is joining me today. So my name is Kim Dunleavy, and I am the principal investigator for this study. So, sorry, I went too far forwards, but the background for low back pain really is the most common musculoskeletal disorder amongst ag workers as a whole, and the horticulture industry particularly. So the negative impacts of low back pain spans everything from the worker's physical and mental health all the way to absenteeism and potentially shortened work longevity, which is particularly problematic when we start looking at the needs for horticulture workers, which increased after COVID for so many different jobs. Labor shortages are a problem, but this is one of the top 5 challenges in all the subsectors for horticulture in Florida. The negative work impact on workers also means that the retention and recruitment makes this shortage even worse. Surrounding the problem, we also, as we all know, the opioid crisis has been in the news over the last couple of years. In Florida, there was a very recent sort of fentanyl surge. And, you know, some of the things that surround the problem is that we really don't want to get to the point where anybody is starting to use opioids just to manage their pain and to be able to work. Of interest to some people, not everybody knows this, but you know, only 3 days can actually move from just using pain medications to becoming addicted. And with fentanyl in the mix, actually 1 pill can actually kill. So that is some of the surrounding background why we started to look at the low back pain issue. And the landscape and nursery industries both have some of the known risk factors, such as awkward postures, the repeated work, intermittent sort of high loads of lifting, digging, and the while NIOSH actually really recommends that, you know, major engineering redesign and machinery is your most effective. Often the small work units involved in nursery and landscape don't have that privilege or cannot afford some of the options. In addition, the variability in landscape and nursery work makes any ergonomic equipment challenging, particularly in landscape where they're moving from place to place. So also background behind this particular study, we had 2 pilot studies that were kind of the stepping stones towards the bigger study. The first one, one of our co-investigators, Heidi Radinovich, looked at the effects of the opioid crisis on agricultural industries in Florida and found that in a survey, this wasn't actual data from hospitals or substance use centers, but that almost 54% of the respondents said that they'd used opioids at some point. Admittedly, this could be from surgical use, didn't have to be sort of addiction related, but 77% of these respondents also cited that they may have been work-related injury along with the reason why they started using or had used opioids in the past. They also reported more severe pain than the other agriculture sectors. And so obviously need-based, we also had clam aquaculture workers that we worked on, and we had developed some strategies to try and introduce ways for the clam aquaculture workers who similarly have lots of low back pain to actually take on themselves. And they reviewed videos and received text reminders And in the small pilot study, there were some improvements in disability and work task pain, as well as the sort of anxiety related to the pain. Self-management as a whole is one of the sort of healthy people 2030 objectives, is to sort of really decrease the proportion of individuals who are experiencing chronic pain, and the use of self-management that can be an intervention which has been looked at before. NIOSH also has a strategic goal to reduce musculoskeletal pain and the impact of musculoskeletal disorders. And so when we started to look at self-management, this definition encompasses the individual's ability to manage pain, also their treatment, so taking an active role in any treatment, any psychosocial components and lifestyle implications. And it does go across chronic conditions as a whole, one of which is chronic pain. The key element of self-management is to be able to actively control symptoms without seeking unnecessary medical care. And so when looking at the evidence for self-management for back pain, there has been moderate effectiveness for pain and some effectiveness for pain-related disability found in other groups, not necessarily in those who are in physically demanding occupations. So there isn't as much about the workers who are working day in and day out in these positions and types of loads. From the ergonomics side, participatory ergonomics is sort of parallel to self-management. It actively involves workers in problem solving and planning modifications for their own work activities. This is fairly common and commonly used in manufacturing and construction and healthcare, but this type of approach has not been extensively studied in agricultural settings. And some of the mixed evidence supporting PE is potentially because the large settings and the variability means that it is more difficult to study in larger groups. However, it's been listed as maybe a beneficial option for small teams, or if they are restricted finances or rural or less developed areas. So what we wanted to start looking at was, could we involve workers using very simple strategies that would both help reduce the likelihood of substance use for pain, particularly opioids, and reduce work-related pain and disability, using both self-management options and ergonomic adjustments. So the two aims for our study are to determine if self-management, along with individualized ergonomic choices, is more effective than self-management alone, particularly for low back pain management and in horticulture workers. The second aim is to really look at the context around it and to really document any factors that might impact the uptake, the adoption of self-management, and implementation or use of some of these alternatives. We have three phases of the study. The first, preparation phase, the creation of video modules, and the effectiveness trial, which we'll discuss today. So in phase one, we started with a literature review and stakeholder interviews, also observed a number of workers and took videos. We then went into the instructional design and developed video content and scripts, as well as lists of strategies. And I'm going to hand over now to Dr. Blythe for the next slide.
Hi, everyone. So we, like Dr. Dunleavy said, we started with a review of the evidence. We really wanted to make sure what we were using, any evidence out there was based on that. And so we, with a health librarian, we were able to pull 626 ergonomic and 338 self-management articles and went through all of those and found 163 that were relevant, and then dived into those a little deeper and found 83 articles that could really help support the video content. And like Dr. Dunleavy said before, a lot of the self-management and ergonomic articles, really nursery and landscape workers were not a big majority or present in those studies. It was mainly like healthcare workers, construction workers, but we did find support for these different items that you see on the screen under both self-management and the ergonomic sections for the video content creation.
So moving on from there, we interviewed 15 industry experts, including owners, supervisors, workers, and insurance representatives. We did in-depth interviews for about an hour online and in person. And this sort of breakdown of the different groups. We had about 5 owners, supervisors, 7 workers. We had 3 insurance and industry experts, and of these groups, we also did some in Spanish. So we had 4 Spanish-speaking workers, owners, and 4 bilingual, and then 7 English participants. So from there, we narrowed down some of the content, and for the instructional design, really sort of emphasized self-management as empowerment to manage and limit pain. We did want to emphasize the non-pharmacological management itself, and we decided to work on opioid risks, not as much on the signs of misuse or Narcan. This was originally one of the topics that we thought about, but on diving into this with the stakeholders, there was some reticence to actually really discuss Narcan from the perspective of would it encourage people to think that it's okay to use opioids on the job. We also started to link the safety emphasis a little bit more to heat prevention and to nutrition. We hadn't originally looked at that as being a major focus, but this is a big area in the agricultural world, particularly on the heat prevention. And some of the stakeholders really felt that the nutrition side would help with energy, maintaining energy throughout the workday, and that lack of energy could potentially lead to overuse and repetitive strain. From the audience perspective, the characteristics that we narrowed it down to looking at being, we wanted to be inclusive across gender, age, and race. But we looked at about a 6th to 8th grade level suitable for, and one that was suitable for translation, particularly limiting text because of this, and the wording and the sentence structure being suitable for this grade. We wanted to keep it very applicable in the workplace. And then another element that came up from the interviews was using the family and income as motivators to make changes. We initially had a list of tasks that we used, but we also added bending, twisting, and awkward positions that were industry specific. So particularly looking at digging, planting, and weeding. We also added carrying equipment such as blowers and weed eaters as part of one area that was more specific to the industry as well. And then finally, the delivery emphasis after the stakeholder interviews came back to really looking at the importance of emphasizing productivity from the owner and supervisor perspective. The retention and longevity being important for both groups. The design that we came back with was really looking at practical components, similar to sort of a toolbox talk, where we would have very short video content that could be used for during rain delays or at the beginning of a day, rather than looking at bringing the entire crew in for an hour of what is traditionally looked at as in-services or safety presentations. The short video content is also more consistent with today's digestible content in a small amount of time from a focus, and trying to get it to the point where we were at about 5 minutes per video. So as we looked at this, we were also starting to think about pluses and minuses, and really the pluses, you know, from a worker's side, motivation to ensure their livelihood. We do have a very good industry linkage with the FNGLA, the Florida Nursery Growers and Landscape Association, and they've been very helpful all along the way. The insurance motivators also came up in that potentially groups that were actually doing the training may be able to go back to their insurance and motivate for discounts, looking at from an insurance side that potentially low back pain could be a reason why insurance and workman's compensation claims could come through. On the negative side or the barrier side, a couple of these came up in the different forms, but looking at ego and how sometimes workers may not want to talk about low back pain or not being able to do anything. And so that came up actually from the workers themselves, who felt like it wasn't discussed at work at all. People didn't share ideas about it. And so that is something from the design perspective that we were trying to potentially promote. Often limited training opportunities, not a lot of training or prevention, particularly related to low back pain, was mentioned. Lots on heat, pesticide, other safety considerations with equipment, but very limited on the low back pain. And then the nature of the work, the variability, weather limitations sometimes means that you may have very intense time periods and others when there's a little bit more flexibility. So we decided to, as I said before, exclude the Narcan and opioid misuse. We also excluded or used limited focus on back braces, and that's because of a lack of evidence in the literature. We are including anti-inflammatories, Tylenol, and creams very briefly, but those are not considered part of the options to use because of this gray area between medication and some of the over-the-counter medications. And because massage and acupuncture, although there is a lot in the literature, is more provider-based and had more costs to it, we decided to exclude those. However, we put more emphasis on hydration and nutrition and sleep, relaxation, and rest, both from the evidence and also from the stakeholder interviews. All right, so handing over to Dr. Blythe, who will talk now about the video development and steps.
So we took all that information and started to create the video modules that we would be using. Like Dr. Dunleavy said, we're really focused on trying to keep short videos, so we really aimed for around 5 minutes. We got a lot of feedback and kind of knew too that there are a lot of English and Spanish speakers in this industry, and so we wanted to create videos for both of those populations. And then we really wanted to film in the actual settings, so things would be as relevant as possible. And we also included some short interviews from people in the industry to kind of make it more relevant and really get that buy-in from the workers. So we came up with 3 videos, and the first video really looks at the importance of managing pain without medication or opioids, questions that you can ask your provider. It goes briefly into kind of a summary of low back pain and really looking at that medication aspect. The second video, we want to provide self-management options for the workers to use. And so we go into the different areas that we're providing resources for. So general and specific exercise, that hydration and nutrition, the relaxation, rest and sleep, and then looking at deep breathing and positivity. For video 3, we really wanted to show ways that they, as the worker, can modify their work task. And so smaller changes they can make, simpler things they can do in their everyday work tasks to really try and help them make the work, not as strenuous for their back, but they're still able to be productive and efficient. So I'm going to go ahead and share. We're just going to give you like a little teaser of each of the videos. So I'm going to go ahead and share that and let you guys see kind of a little clip of what we worked on.
pain is extremely common. About 1 in 3 people have back pain at some time. Often, lower back pain will get better without treatment. However, these short videos will help you limit and manage back pain without medicine so that you can keep working for you and your family.
So that's from video 1, and then I'm going to show you a short clip from video 2.
Your body and muscles often get tight when you are working hard all day. Before or after work, short stretches held for 10 to 20 seconds can help your flexibility and pain. Stretch as often as you can. If your pain increases, don't stretch all the way or push through pain. For the spine rule.
Okay, and then show you a short clip from the last video that's really focusing on the ergonomic options.
One of the hardest positions is bending forward for a long time. Twisting and bending when reaching into tight spaces is even more of a problem. Find ways to work so you don't have to bend as much or twist at the same time. Using benches or higher surfaces is a great way to decrease bending.
Okay, so those are just some short clips from the 3 different videos, just to kind of give you a little teaser on that. And we really, like I said, wanted to focus on trying to include as much footage from the actual nursery and landscape workers in their setting. So after we created our first draft of the videos, we went and got almost 30 people to give us input on the videos. And there's really a variety of people. We were looking at different areas. And so you can see on there the different, the variability in who we looked at and the information we got from them. And so the main points that came out of that feedback was that initially we had more landscape clips and we didn't have as many nursery clips. And so we really wanted to add in more nursery clips, make that part more diverse, and just adding in more work settings and more tasks that were applicable. We also got some input on the narration that they, the thought was really that a male narrator would be better and would be more well received. And so that gave us some input moving forward. Initially, we did not have the exercises in as much detail. And so we got input on increasing that detail. And with some of the terminology, like pacing is one of the terms that can be a little confusing. And we got some input on the best way to really talk about that. And then really, as we created this, it started in English. We always knew we were going to translate it to Spanish. And so we really wanted to make sure the English was easy enough. The terms were going to translate well into Spanish. So we went into the draft, video draft 2, and really made some of those adjustments. We adjusted the script, did reshoots for additional clips for the nursery workers and the exercises, worked with the video editors. And the third video had a lot of content in it. And so we really reorganized it and chunked the material so that it would be easier to follow and easier to understand. And then for our final draft, we had to add in the professional narration and then create the Spanish version, get it translated, and input that information. So those are kind of like the broad overview evaluative feedback. And so this kind of gives you some specific examples of what we had to think about as we were going through. And so initially we had a literacy review done by 2 health librarians who are experts in that. And so they provided us with some great feedback on terms to make simpler things, as like using medical problems versus medical conditions. And so really taking some of those terms and making them easier to understand at a lower reading level. And then we went into the second video draft and had to have some of those Spanish considerations as we were thinking about translating. So something that came up is the word for soreness and pain are the same word in Spanish. So we had to look at how we were using that in English. And even things like pulling in your abdominal muscles doesn't translate very well, but tighten your stomach does. So we had to keep those things in mind. The organization of it, we got some feedback. Some of the video clips weren't as applicable. We had initially some on yoga, Pilates, and so took out the things that were not as applicable. And like I said before, really did that chunking for the last video and added that nursery. And then for the final polishing, we really wanted to look at, we got input from native Spanish speakers so that we can make sure the translation, everything was cohesive and, you know, matches for the masculine, feminine. And then we're going through and looking at the consistency across all the videos, making sure that everything is the most polished it can be for the final draft. The stakeholders gave us feedback on some of the things to change, like I talked about before, but these were some of the positive things that also came out of that feedback and really were encouraging to hear. And so my favorite one was they were like, this is not your typical safety video. Like, this is not like the boring 80s video that we've been watching for 20 years. So, you know, a lot of people thought that the workers would pay attention to it. They really liked the short length and thought that the pace was good and kind of kept it moving. It didn't really drag. And felt like really kept their attention, and they think people will learn something from this. So this kind of just an overview of everything I've talked about so far is that as we were going through, we really had to keep a lot of these things in mind when we were creating the videos. And so looking at the length, you know, Spanish sometimes can go longer than English, so we had to make sure that the length would be similar, and trying to really have a variety of clips as we were going through, so it wasn't all one setting, all one task, and making sure that there was a variety of genders, ages, and everyone was represented. The music, we wanted to have like upbeat music, keep the attention, and then really looking overall the organization, making sure that it was organized in a way that was easy for people to understand and to remember.
Thank you, Dr. Blythe. And just to mention, this took a long time, so we're just getting through it right now. But we're moving now into the phase 3, which is the effectiveness study. And so what we are going to be doing is a pragmatic randomized study. We're going to use within subject repeated measures and do a pre-post, but we're also going to use a baseline control period. The enrollment criteria will be working in nursery and landscape for at least 30 hours a week. Over 18, and in small to medium-sized businesses. We are, you know, as Dr. Blythe said before, we're looking at English or Spanish. We realize that there are other languages, including Creole, that we're not covering right now, but just based on the workload to be able to get the videos done, particularly, we needed to start with 2, and it can always move into the other languages after that. The workers do need to have low back pain in the last 3 months to be able to be included, and being willing to be videotaped during their work activities. However, we are excluding anybody who has a major history of major accidents, surgery, or spinal injections in the past year, applying for disability and workman's comp, or self-disclose that they're pregnant. We are providing incentives for the study, so we really are recruiting at the group or worker, the organization level first. So once we get approval and the company is okay for their crews or workers to participate, the owners and supervisors we would be working with to help encourage the incentives to participate, or in using their supervision component just to allow the workers to maybe work on their ergonomic changes a little bit. So we are providing 2 incentives there, $50 each, and they would be going just through the training. They don't have to have back pain to be able to participate. The workers, we will have incentives for $25 for their first survey completion and $50 after that, for a total of $225. We're about to start our first group, but we are currently enrolling, and we're looking at companies or groups within companies for the next couple of years. And the schedule, we are very aware of the fact that summer is the busiest time of the year, but we are open to scheduling now or later to start. And the study timelines are once every 3 months. So we have these 4 sort of phases. The first control phase will be starting off, we'll do a baseline set of surveys. Then at the end of the 3 months, we'll do another set. We will show the videos and ask the workers to select 2 strategies to use for about 10 weeks. We'll come back, do the surveys again, and then we do 2 follow-ups at 3-month intervals after that. The timelines for the pre-post and follow-ups will be using iPads to actually collect the data, and this are 4 or 3 big groups of surveys in here. Approximately 5 to 10 minutes for the surveys, although at the videos take about 15 minutes. So that will be a little bit longer at the pre-visits. These are the self-management strategies that we're asking the workers to select from. So what we're asking them to do is, once they've looked at the videos, is to choose one of these self-management strategies that they can use, and then to use that regularly for the 10 weeks. So it could be any one of these. And one of the ergonomic strategies to use as well. We are asking the participants to match their strategy to their most difficult work activity, whether that's lifting or twisting or standing for long periods of time. But the work adjustments could be completely different across the group based on what they actually choose. And then what we hope to do is also document the actual type of context. So for example, we may be looking at the size of the business, or the number of workers in a particular group, or how they organize their work activities, and using that to help explain any results, both barriers and facilitators at the end. So we'll have the surrounding context to help explain any results that we get, and hopefully use that to come up with a broader picture. So this is just a number of different areas that we do think could potentially affect whether participants even do adopt the strategies. If we have a group where the labor availability is just really, really, really low, that could easily affect the stress and the workload. The team characteristics, maybe the type of supervision or the involvement of the leaders in the actual work activities too. So we're starting to look at groups who may want to participate. So we would be very happy if anybody here is interested in participating, or potentially could refer anybody that you think might be interested. We will organize around the business availability, and there is a Qualtrics link on the PowerPoint right now, but we'll also post that into the chat. And then the contact information, both the email or the telephone number, we'd be more than happy to explain the study a little bit more if anybody is actually interested. The study is funded through the Southeastern Coastal Center and NIOSH, and just the acknowledgement that any of the information is our responsibility. It doesn't represent the official views of or endorse the CDC NIOSH group. But we do definitely want to put a big thank you out to the Southeastern Coastal Center, to the College of Public Health and Health Professions Instructional Design and Media team who've helped us throughout on this. Our stakeholders who provided all the feedback on the interviews and the videos, and Big Trees Landscaping, the UF Grounds and Facilities, Tropic Traditions, who also provided opportunities to film on their locations and with their workers, and especially to the video participants. So we have an extensive list of references, courtesy of Carolina, one of our research assistants who's put this together, who's on the call today. Thank you, Carolina. And there's some additional references there if you would like to look at those. But thank you, everybody, and we'd love to open up for any questions in the chat.
Well, thank you so much, Dr. Dunleavy and Dr. Blythe. Wonderful presentation, and I really appreciated learning all about it as well myself. So first off, I just want to open it up as like Dr. Dunleavy said, in the chat or the Q&A. Greg, I see you have your hand up. If you want to just type a question in the Q&A or the chat, we'll keep an eye on that and relay those questions in. So we'll give everyone a couple minutes, gather your thoughts, and then we'll keep an eye on the chat and the Q&A.
Thank you, Chucks. Appreciate it. I would love any comments about, what you think, how it, any feedback we may have or you may have as well, but any tips? Maybe tips on recruiting participants in groups would be amazing. And if there's no questions, perhaps any comments on low back pain as a whole in the groups that you work with, if you see the, so Greg, do the participants have to be in Florida? Good question. Unfortunately, at the moment, yes, unless of course you'd like to fly us up to North Carolina, we'd be happy to do that too. But right now, from a travel perspective for the team to actually get there, yes, they would actually have to be in Florida. We're starting to recruit mostly in the North Central area, but we're open to other areas as well. Orlando, we've Gainesville, obviously, Jacksonville, that area is easiest for us to get to, but we are open to other areas if anybody is interested. And absolutely, we could certainly share the the flyer with everybody. If you'd like to send just a note to the email, we'd be happy to send you the flyers as well. I think as we went through the stakeholder interviews, some of the things that we found that were really interesting was that the low back pain element of safety is probably an area that is under, it's lower down on the list when it comes down to heat safety and pesticide safety, obviously, but also because of the repetitive strain nature, sometimes it can creep up on you. And so that, heat stroke comes up real quickly. Low back pain is a little bit more longer term. Greg, when would the videos be available? We will need to finish up the study first before those will be available. And then at that point, we hope to make those available on the Southeastern Coastal website, as well as through FNGLA. So the sooner we get all our participants enrolled, sooner we'll have the videos available too. Thank you for your questions and comments. Appreciate it.
There was one question in the Q&A about basically taking water breaks and having crew leaders. There being some history of people not choosing to get water so they don't have to waste time. So there was a comment from Ernesto about taking this into consideration.
I think that's a really good point, and I think that goes generally into the agricultural group too. Any of the agricultural groups where people are being paid by piece or being paid by time, the disincentive of taking water breaks versus actually looking after their own body is a big one. I think the other part here is what we are trying to also encourage is you don't have to take a full break, but you can actually reverse your position. If you've been bending for 20 minutes, standing up and doing a couple of reversals is a mini break from the position. So not having to, and then we're also trying to, as you said, encourage everybody to drink water regularly. And so that becomes a mini break too. And it's mini. It doesn't have to be 5 minutes. If you're going to get your water bottle and drinking, that's going to save you time longer, down the road. A great comment. Thank you. Dr. Blythe, anything you wanted to add?
No, just thank you guys for coming, and thank you. I think the comments too are helpful, even like the contextual comments for us to keep in mind. And yeah, we really appreciate you guys coming in and watching our presentation on the study.
Yeah, I have one last question, and if anyone else does, feel free. But I know you both have been kind of working in this area for a long time, and I would think just like the awareness and the education part is a big factor in making people aware of, what these movements and what these actions will do long term. So like, what is some of the what have you learned in the past and currently about just the like awareness factor up front, even before interventions may be taken?
I think I'll take that from two directions. I think one of the things that we have heard from a number of the more experienced workers or owners is that they actually really take care of their bodies, and some of these elements that are in the videos, things like exercising, stretching. Some of them do yoga every day. Some of them do strengthening exercises every day just to maintain their body so that they can work for longer. Some of them have learned that the hard way because they have had back pain. And so, that sort of retrospective, I wish I'd done this earlier, has come up a lot in the more experienced workers and owners. A lot of those individuals also really are very supportive of their workers doing that. Some of the workers don't always, some of them really put a lot of value on keeping their bodies at the top level. And so it's almost like from a sports perspective that you really need to prioritize it. But then there's others that don't necessarily think about it either. And so, I think the variation across the group is interesting. And depending on where you're working, you may have a group of people that really are encouraging each other, whereas the other component is there may be others that are not doing that. So
Thank you very much.
Greg, your comment about the landscaping and tree worker website, that would be fantastic. Okay, thank you so much. We really appreciate that. Tree care workers in particular, yeah, lot of heavy load and lifting there, and also some of the equipment. So something else that's been interesting as well is that, while equipment is really important and some of the newer equipment is really taken off the load of some of the workers, there's different elements. So for example, people that are sitting on the riding lawnmowers, often on slopes or bumpy areas, really get a lot of shock from that. So, I think the variability, and what we've tried to do is build in the variability into the methods so that people can select the ones that are most appropriate for them. That's kind of the critical element that I think from the design that we're looking at.